Firstly, I would just like to acknowledge the traditional owners on the lands we meet today, all of the lands, and recognise the connection to land, water and culture. I would like to pay respect to elders past, present and emerging. So if I could quickly introduce the speakers for you, we've got some great speakers today. Mariana Kelly is the Senior Risk Advisor for Advant. Mariana assists members of Advant through the provision of Medico legal advice, risk assessments and the development and implementation of risk management strategies. She's worked within the medical industry for 30 years and her experience is wide. It includes general and midwifery nursing, managing large medical practices, consulting to medical practices, including general practices, which is great, medical specialties, universities, developing dispute systems, mediation systems, and lecturing in practice management. She has a master's in risk management, so she's able to support the theory of risk management with a practical experience, and that will come across in today's presentation. She's also a fellow of the Australian Association for Practice Management. We also have Annabelle joining us today. Annabelle's role is a risk advisor for Advant in the Brisbane office. She assists members of Advant through providing risk assessments, member risk education and risk management and prevention strategies. She's worked within the medical industry for over 30 years as well, and her experience again, it includes general nursing, education, operating theatre nursing, both in public and private and paediatric. She's also worked in education and management roles within commercial healthcare medical device companies. Her healthcare experience is in a broad range of specialties, has provided her with the sound knowledge and understanding and the potential risk for members of Advant. And we also have with us today Tony Friend. He's had over 20 years experience in the insurance industry, both in Australia and the United States, with a specialist knowledge of general insurance. He's the business development manager for Advant, and he believes experience and human relation skills are the key when assisting and developing relationships in the medical industry by ensuring they have the right medical indemnity insurance and general insurance in place to protect themselves. So over to you guys. Thank you.
Thanks, Amber, and it's great that Annabelle could join us this morning, and Tony, and also welcome to everybody else who's got up so early to be at this session this morning. So please feel free to ask questions along the way in the chat field, and Amber will monitor them for us. So today we're going to be talking about managing difficult situations, and we decided to use the current COVID situation, which you're in the thick of, to illustrate some of the difficult situations that you can be faced with. Our presentation will include the planning, how to plan and the processes that you should put in place to prepare your staff to deal with difficult patients. What considerations do you need to have in place during this COVID, and particularly dealing with people that are going to be non-compliant to what needs to be happening in your practice to manage the spread or prevent the spread, hopefully, of the COVID-19. And this includes patients as well as staff that can be difficult. And the principles to consider when challenged by a patient's behaviour.
So thanks everyone for being here. Mariana, from a risk management perspective, let's talk about the main issues that we've been seeing in the past few weeks in relation to the current pandemic.
So we've had a lot of questions relating to developing a COVID safe plan, and I'm sure some of you already have this in place, but we'll go over some of the issues. Even if you do have it in place, it helps you to review that what you do have in place is current. And for those of you that don't, it hopefully will be worthwhile, some of the points that we provide. I've listed a couple of internet links in the overhead there, which you'll find really beneficial to review your current COVID safe plan or to actually develop a new one. Some of the issues that you need to be considering is remember to revise your plan frequently and keep up to date when conditions and restrictions change as you know, this is actually a moving feast, and it can be quite dramatically different from one day to another. I mean, luckily in Queensland, we seem to be settling down again, and let's hope we stay that way. I noted on the ABC News that Western Australia had something like 138 or 158 days without any infections. So let's hope we get there soon as well. We're very fortunate not to be like Victoria, so I think it's also good to count our blessings. It's good to delegate a staff member to drive the COVID safe plan, to make sure that someone's delegated the responsibility to keep up to date with the most recent announcements. But of course, that has to be in communication with the rest of the practice. That person doesn't do it on their own, but that person can drive it. So the links that I've included up there have toolkits in there, and they will assist you to work out what resources are available and where you can go for support. It really will help you to develop a clear plan for trading through and after the COVID-19 pandemic. It doesn't take long to develop, and some of the things it covers is keeping your people safe, including your occupational workplace health and safety responsibilities, how to make your business COVID-19 safe and survive it, how to respond to a COVID-19 infection. The AMA guide includes a really good checklist on communication, practice layout, and prevention. Other items include how you can track and trace patients if needed. Where do you go to if you need to have the intense cleaning of the practice if there have been some issues. Some of the questions that are asked is, am I breaching privacy by keeping a visitor's name and phone number on a list? That's also in those plans. How do I respond if I have a positive COVID? How to deal with those patients that are angry and have been tipped beyond breaking point. Some of them can be abusing staff, refusing to answer questions, refusing to wear masks, and I'm sure all of you have come across this, unfortunately. And what do you do with receptionists that work at a couple of different practices? You know, they could be branch practices. This has to be obviously declared. And where do you get your PPE education for your staff? And that can be through the health department, Hand Hygiene Australia, and the PHNs are a great resource. Not just through COVID-19, but through many areas of your practice. And I'm sure all of you have found them an excellent resource. And I particularly hear really good reports in the regional areas of how supportive the PHNs are. So I'm going to put a question to Annabelle. Annabelle, that medical practices have appointment schedules, which would be obviously able to track a patient if they came into the practice and there was a subsequent infection. Are medical practices obliged to use a QR app to track visitors to the practice?
Look, that's interesting because they're just becoming commonplace, aren't they, everywhere you go? And a medical practice obviously should keep details of all visitors to the practice. So that's people accompanying a patient, as well as contractors, suppliers, as part of its COVID safe plan or, you know, risk management plan. Because of course this will more easily enable contact tracing if that's required. But a practice is not actually required to use a QR app, but it certainly is one option.
And so are you saying that if people, like patients, bring carers or relatives, etc., with them to the appointments, that they should register as a visitor to that practice, and that we just don't rely on the appointment schedule book?
Well, yeah, so one option obviously is the QR app, as I've said, where visitors to the practice scan that QR symbol using their phone and then enter their contact details into the app. And there are a few different companies that offer this service to medical practices. Look, the main issue with some of these QR apps is that they have their own privacy policies, of course, which are quite different from the practice privacy policy. Now, for example, some of the QR apps might allow for, you know, direct marketing to patients, and that's actually written into their privacy policy. And some practices have developed their own QR apps in-house, and what we've found that these ones are generally very good. So it's important for the practice to review whatever app they're choosing to use as privacy policy before agreeing to actually use it. And an example of that of this privacy policy that we reviewed for a practice stated that, and you know, this was actually just click through to their privacy information. It says your information may be stored and processed in Australia or in any other country in which covidpass.com.au or its affiliates, subsidiaries or agents maintain facilities, by using this website, you consent to transfer of information outside of your state or territory and outside of your country. And also, obviously, with the Australian privacy principles, and number 7 specifically in relation to direct marketing, an organisation may only use or disclose personal information for direct marketing purposes if certain conditions are met. Your patients would have to be aware that this was happening, and I'm just not convinced that a patient coming into a medical practice would expect to be linked to campaigns for direct marketing or cookies or anything like that. So this, you know, might become really annoying to them and could, you know, potentially generate a complaint.
Yeah,
you know, the current pandemic, the current pandemic is presenting us with many difficult situations, and we certainly know a number of practices are seeking advanced assistance to manage these sorts of patient complaints. So over to you, Mariana. Can you give us some examples of complaints that patients are making and that we're seeing in advance?
Yeah, well, in the most recent weeks, we're seeing issues such as patients refusing to be able to access a face-to-face consultation. So the doctors are refusing to provide a face-to-face consultation. And then others that won't conduct a face-to-face in the practice at all, and they'll only see the patient in the car park. One was, which I found quite amazing, was a refusal to allow patients to use the bathroom in the practice. If any of you have had a COVID test, you will note that, you know, the swab is uncomfortable, and there have been complaints about the swab going too far up the nose or not far enough up the nose. Others where the referral was not received by the COVID testing clinic when the patient turned up to have their test. Complaints that practice is not following COVID safe requirements, which I found really interesting. So that's obviously patients' anxiety and their reporting non-compliance or their perception of non-compliance. And things such as refusal to provide a script for COVID medication. And a lot of you would have heard over the time in the last, you know, quite some time really, the different medications that have been put forward as the solution to COVID-19, and this will stop you getting it or stop you from dying. And there's a lot of pressure being put on our GPs to provide those scripts, and there is no clinical evidence that they are effective, and so that has really caused some problem as well. So, Annabelle, I think it's it's a whole mixture of complaints, and I don't think that's going to be the end of it. I think we're going to see a lot more.
Interesting that patients are, you know, obviously doing their research and finding out as much as they can, and then complaining if they don't think COVID safe plans are being followed. And interesting too that a practice is, you know, trying to stop a patient from using a bathroom. You'd think surely signage about hand washing and, you know, educating patients when using the bathroom would do. So let's look at examples of the ongoing difficulties practices are experiencing during the pandemic. So a doctor has expressed concerns relating to patients coming into the surgery who are unwell with flu-like symptoms. So they don't want to see these patients unless they've actually been tested for COVID-19. Can a doctor refuse to see a patient with cold or flu-like symptoms, Mariana?
Well, doctors aren't legally obliged to treat patients unless it is an emergency or contractual requirement. Discrimination laws prevent medical practice staff from discriminating against patients on the basis of a disability or an impairment. And for example, that could be COVID-19, or another one could be ethnic origin. However, a doctor can refuse to see a patient if it is reasonably necessary to protect the health and safety of any person. And that includes medical practice staff as well as patients. And in determining whether discrimination is reasonably necessary, you need to really be very up-to-date or consider the up-to-date expert advice. And I recommend that you look at the Department of Health guidelines about that and about managing patients with suspected COVID-19. Practices and hospitals have an obligation under workplace health and safety laws to ensure the safety of their staff and the patients that are coming to the practice. It's reasonable to refuse to see patients with symptoms of COVID-19 if the practice can't comply with the safety guidelines provided by the Department of Health. And also, some of you are probably aware, RACGP has some really good resources as well. And even on that, just to point out that if you haven't been to the event website, ever since probably February of this year, Event has some very detailed frequently asked questions on our website. There's a section that's just about COVID, and they're updated quite regularly. And there's quite a lot of various topics included in that. So I would recommend you look at that as well.
So then, Mariana, how does a practice take reasonable precautions to protect the doctors and staff and indeed the patients in the waiting room?
Well, I think if we think about it in the same way as how we would normally have our triage processes that everybody, particularly the people at the front desk, are familiar with, you know, there's sometimes flow sheets, etc., with the triage, and I think we should also make sure that we have triage procedures specific to COVID in place, and maybe even an eliminated sheet on the front desk to ensure that people are familiar with what needs to occur. And this will ensure that appropriate precautions are taken to protect the doctors and the staff and patients, of course. And it can include questions such as, and I'm sure a lot of you are familiar with this, has the person experienced a fever, cold, runny nose, shortness of breath, and other symptoms recently? Has the person travelled overseas in the 14 days before developing symptoms? Now, we know that's probably unlikely these days because people aren't allowed out most of the time, but it's still worthwhile checking because some people have had exemptions to travel overseas for, you know, sick relatives or whatever. And has a person sought advice from a medical practitioner? Has a person being diagnosed with COVID-19 or come into contact with somebody who has been diagnosed recently? These are the ways that you can assist also in managing patients' expectations of what to occur. So if you ask those questions and the front desk staff have been scripted to ask these questions, the patients understand that this is the norm, that this is the questions are being asked for a reason to protect them, other people in the practice and other patients. And other ways of managing patients' expectations of what's to occur at the practice include placing signage outside the practice entrance. That helps to communicate what your protocols are in your practice. You can place signs telling people to call the reception desk or to tell reception staff the moment they come in, and especially if they've got any symptoms. And there's some really excellent posters on the RACGP website and in that AMA guide that I spoke about. And I think it's also good to include it on your website, the messages about how the COVID is being managed, what to expect when you come into the practice, and maybe even on your phone service, so on your on-hold message and on your answering machine. And a lot of it is about managing patients' expectations. If patients are sort of informed about what to expect when they come to the practice, they're less likely to become aggro with you.
Yeah, that's so true. And I know it does get a bit annoying asking the questions over and over again, and particularly I guess the one with the overseas travel, because it just seems crazy that that happens. But when you actually look at the numbers of people coming into the country every day, they're in the hundreds. So I don't think it's unreasonable to continue asking that question at all. A friend of mine recently returned from Wales. His father passed away, and you know, he came in with 200 people to one hotel, and that was just one day. So if a patient presents to the practice with respiratory symptoms or lies in the screening questionnaire, which we've certainly heard as well, to get to see a doctor, what should the practice do, Mariana?
And you're right, Annabelle. I mean, it's not just a couple of people that we've heard this has happened to, a couple of doctors, or it's happened to quite a lot. And I think that's why some doctors are saying they won't see patients with any symptoms at all. But I think this is the advantage of having the signage and the protocols displayed, because you can refer to that sign and the protocols. You could also include a sign that says failure to adhere to the practice policies and protocols may result in you not being welcome back to the practice. And if a patient breaches the protocols, you could ask the patient to leave the premises by restating that the protocols are in place, they didn't adhere to them, they've lied when asked the screening questions prior to entering the practice, and that they've, you know, exposed other people, and other people are at risk, not just other patients, but staff and the doctors. And I think particularly the doctor needs to be comfortable that it's not an emergency situation, though, before you ask a patient to leave the practice. They need to ask questions such as, is the patient experiencing chest pain, difficulty breathing, etc., prior to asking that patient to leave. And make sure your findings are documented in the patient record.
So is it appropriate to take someone's temperature prior to entering the practice?
Yeah, as part of the screening, yeah. Look, the current advice appears to be that temperature testing may be appropriate in high-risk settings such as medical practices. It'd be helpful for medical practices to have a protocol about the temperature testing, including how patients with a temperature will be managed in an emergency situation, and a requirement for a doctor to take the patient's temperature during the consultation, as that obviously is for a different purpose. I know not all medical practices are doing the temperature testing, so that's really on an individual basis. You know that some businesses are, and you turn up to some retail shops and they're doing it, and you know there's a real question about the relevance of temperature testing. The medical advice says a temperature of more than 37.5 may be a symptom of COVID-19, but as we know, there are a lot of other symptoms of COVID-19, and sometimes patients don't even have a temperature. So, you know, there is a question about, you know, not just relying on a high temperature. The fever can go up and down during an infection or after taking medication. It might be down at the time that you check that person. And as I said, there can be a lot of other symptoms that, as you may all recall from the news, the health worker at Ipswich Hospital a week or so ago, maybe it was a couple of weeks ago, his only symptom was stomach pain. And he reported that to the managers. And in fact, he did have, he was positive for COVID-19. So it sort of proves the point that, you know, temperature alone is not the only issue.
So what about conducting temperature checks on workers, you know, within your organisation?
Well, again, you may want to monitor the health of your workers through temperature checks as a preventative measure, and some workplaces are, but you know, maybe particularly in the practice setting. But it's an individual practice choice about that. I think if you educate your staff about the risks of coming to work with any symptoms at all, and that to be really adamant that no one is to come to work with any symptoms, that may reduce the requirement for you to be doing that. I mean, in some businesses, obviously, or some you know, facilities, it's obviously more important, or it may be very important, and that is where people might be living together in accommodation, such as fly-in, fly-out workers in the mining setting, agricultural workers, or in workplaces where vulnerable people are present, such as hospitals and aged care facilities. So, you know, for many workplaces, there may be little benefit in conducting temperature checks on workers. And if you're concerned about it, I recommend that you seek advice from your public health authority to find out whether that is necessary. And also get advice on leave or stand down arrangements for employees who do register high temperatures.
Right. Hooray, the end of presenteeism. I'm glad to see it. So we know that practitioners are under stress. You know, we get a lot of calls about this because they're being asked to provide medical certificates to patients as employers are insisting that they have a medical certificate. What should they do?
Well, many people are asking for certificates for you know, your normal medical certificates, of course, when you are sick, but employers are asking for certificates for the person's fitness to work, and others are asking for a certificate for a vulnerable person certificate, and that means that, you know, somebody who may be living with somebody who's a vulnerable person is asking for a certificate to say that they shouldn't be coming to the workplace because a vulnerable person that they're living with may be exposed. And of course, the vulnerable person who is working with you, and that may be somebody in your workplace who has a lot of comorbidities, and, you know, some employers are asking for certificates for them to state that they have, you know, comorbidities and that they are vulnerable and they can't work. And Others are asking for medical certificate for exemption from quarantine. For example, you know, to go and see a dying patient or to allow relatives into Queensland. And the bottom line is that all medical certificates written by doctors, they should be objective and they really should be documented as what the patient has told them. And the doctor should be relying on the information the patient is telling them, and that is what they write. They don't actually go into detail about their opinion of what could be happening.
Right, so can a doctor write on the medical certificate for a healthcare worker who is COVID-19 positive and claims that they contracted COVID-19 at work?
The doctor can confirm the COVID-19 diagnosis if it's clinically appropriate, and that the patient told the doctor that he or she contracted in the workplace. But the doctor needs to assert that that person contracted in the workplace, cannot assert rather, because he or she doesn't know that. It's only going on what the patient information has been provided to the doctor. So it really again is that the patient stated and remain objective and not give an opinion.
So can a doctor provide a certificate to exempt someone from a public health direction then?
Definitely not. Only the police or a regulator can do that.
Right.
So, Annabelle, I'm going to ask you what would be your risk advice if a practice phoned and said that they want to refuse to see a patient who's not wearing a mask? And we've had a lot of this, haven't we?
Yeah, we have. And certainly in some states, such as Victoria, it's mandatory to wear a mask. And this is also the case for some situations in New South Wales. And, you know, as we said before, it's a moving feast. It can change from day to day. And, you know, I'm certainly getting my children on public transport to wear masks when they can't socially distance from others. So in other locations, the current advice is that wearing a mask can help protect you and those around you if you are in an area with community transmission and physical distancing is not possible. As I said, you know, for example, if you're travelling on public transport. Now, as the occupier of a private medical practice, you are entitled to take reasonable steps to protect your staff and other patients on the premises by making it a condition of entry that a person wear a face covering on arrival at the practice unless they have a lawful reason not to wear a face covering. So patients who attempt to enter the premises in breach of these conditions may be removed for trespassing, but we recommend that you speak with the patient about their reason for not wearing a face covering before you exclude the patient from your premises. So if the patient has a reasonable explanation, so for example, a medical condition which prevents them from wearing a face covering safely, you should consider what other risk management strategies you can adopt to keep everyone safe. As an example, you might consider asking the patients who are not able to wear a mask to sit in another room other than the waiting room. I mean, it's really challenging, isn't it? What would you recommend to assist practice managers to actually put this into place in their premises, Mariana?
Yeah, I think again it's around education. I mean, we're asking the front desk staff particularly to take on, you know, quite some responsibility and all this screening and almost to be a policeman in a way. And I think if we educate our staff well, prepare a script for them, get them to practice what to say to the patient, get them to practice how to prepare the patient for what they will have to do. If they feel a patient won't comply, then be prepared to use that plan for what other way you can give care to this patient if they genuinely can't comply. And there are some people who genuinely cannot comply with wearing a face mask. And, you know, an angry patient is often a patient that was not aware of what is going to be happening. So again, it's about managing the patient's expectations. And sometimes if they understand, it's about protecting the very doctor that is caring for them, they will comply. As you know, a lot of patients are very dedicated to their doctor and they wouldn't like anything to happen to them. So that can, you know, making even that statement that this is also to protect the doctor that's caring for you can be that switching point for them, and involve all of the team in all the things that is necessary to keep the practice safe. It's as much as their responsibility as it is yours as a practice manager to keep the workplace safe, and as it is for the patients who are coming in. They have responsibilities to keep this workplace safe for people who are working there, and as well other patients that are coming in. And it might be worthwhile reminding them of that. Some of the things that you're probably already doing is removing some chairs, so the distancing is there, marking exit and pathways, and marking the floor.
Yeah. So what should practice managers do if a patient is still refusing to wear a mask but then becomes aggressive, or, you know, gets the smartphone out and starts filming the discussion, which, you know, we've seen a lot of in the media? What should they do?
Yeah, and I mean, we'd all, I think, be quite confronted if we had somebody putting a camera up to our face, and you know, filming everything that's going on, and that would often already initiate almost a combative response. So I think we need to be very careful of that, and maybe shift your thinking to that the patients are naturally frightened, particularly patients who have comorbidities. And there's so much in the news every day about COVID safe that, you know, there is a mental health effect on this. And I think all of us have probably experienced through this some psychological sort of response. I know I have. There are days that I just won't turn on anything about COVID. I won't watch Coronacast. Sorry, listen to it. I won't do anything. I won't watch the news because I've just had enough. So, you know, I think that's a natural response. And patients really are quite frightened, I think, of everything that's going on around them. And they're depending on you in the practice to keep them safe, but also to keep them informed. But it's hard because they simply can't comply, some of them, because they may be suffering from mental health. So that's a really difficult one to deal with too. If you do have a patient who suffers from mental health, that patient obviously has to be dealt with quite differently to somebody who is fortunate enough not to have a mental health condition. And sometimes we've just got to think outside the square. One practice set up their back door where patients that couldn't wear a mask could come in, and that's usually the door that doctors would leave from, you know, after work or to escape or whatever. And they set up this back door area where the patients that couldn't wear a mask could come in, and they then used a room that was normally for stores and set that up as a quasi consultation room, if you like. And the patient actually would come in and sit there whilst they were waiting for the doctor to come in, so they weren't exposing anybody else. I've even seen practices where there are a few chairs spread wide apart outside the practice where patients wait until the doctor comes to call them inside. And Annabelle, you've had an experience, haven't you, with you know, your children, one of the practice that you take your children to, and how they managed it.
Yeah, I thought it was really well managed, actually. They had set up a triage desk outside of the practice where you used hand sanitizer, popped a mask on, had a temperature check, went back to your car, and our doctor called us in straight through to the room, and then yeah, I found that really good. And you know, I didn't get any pre-warning about that, but it was such a strange time. But then in subsequent, I book all my appointments via an app, and now it's got a pop-up when you go to book your appointment on the app explaining the procedure. I remember I was a bit shocked that first time, but you know, they quickly they quickly changed it so that when you go to book an appointment, that notice comes, you know, as a pop-up telling you what to expect, which I thought was a really good idea.
So really, again, it's another way of managing patients' expectations, isn't it? You saw that pop up and you knew what to expect when you got there, rather than turning up and being confronted, you know, with these situations, which can make you pretty peeved. And I think, you know, the practice staff, where possible, need to remain current with the information of what is to occur in the practice, to protect everybody, and to try and remain calm. And our receptionists need a lot of support to stay current and to use the right words to prepare patients and to tell them why it's necessary for them to tell the truth, wear a mask, Like, remember, it's not just about them. It is about the other vulnerable people in the practice. But do the patients know that? So it's the way you're delivering the message. And I often say, you know, speak slowly and gently to the patient, as even if they're starting to become a little bit aggressive with you, they may naturally mirror your language style. Because you're remaining calm and you're speaking slowly and you're speaking gently to the patient, try it on somebody who's starting to become aggressive, and I think you will find that there's just this natural, almost you can see it physically coming down, their reaction to you. And some practices have set themselves up so that they'll only do a face-to-face after a telehealth consultation has been conducted. But you need to be really careful with that with Medicare issues as well, whether that is a legitimate sort of situation. I mean, obviously it is if you've done a telehealth consultation and then you find that that patient needs to physically be examined, that would probably be quite reasonable. So, Annabelle, many practices are reporting to us that patients are more stressed than usual, and that's no surprise when attending the appointments. And many attend the appointments without a support person because they're all worried that their carer or their relative may also become sick, so they don't want them to come. Or indeed, as you know, some practices have actually said, you know, no carers and relatives are to come when it was at the height of the COVID. This often will lead to many follow-up calls about the medical advice that was given during that consultation, and that puts another load on the doctor and on the receptionist staff fielding these calls when the patient has already been in that day. How do you suggest practices manage this?
Look, I think where possible, to schedule a phone call with the carer whilst the patient is in the consultation might be an idea. The doctor can also provide written instructions of what's to occur next for their medical treatment to try and circumvent those follow-up phone calls when they haven't been able to have their carer there. You know, one of the most difficult parts of a practice manager's role is obviously managing staff too, Mariana, as you know. And if you proceed to the next slide, staff management. Staff management during the COVID-19 pandemic has presented some unique and novel situations. Safe Work Australia has developed an online hub, and you can see the website there on your screen with information on how to minimise the risk of COVID-19 exposure in your workplace. Now, they update this daily, and many practices are asking how they can manage staff who can refuse to comply with COVID safe plans. So, Mariana, I mean, we do get calls about this. So how can you manage staff who refuse to comply with COVID safe plans?
Yeah, and as you say, look, dealing with staff can be very difficult at times, and I'm sure all the practice managers on the line, as well as even some receptionists who are working with some difficult people, find this is the bane of their life. I know when I stopped doing the hands-on practice management, that was one of the things that I missed the least, was actually managing staff, because it can be quite stressful. So I'm going to provide some risk advice in response to this question, and I want you to be very mindful. I'm not a lawyer, so if any employment-related issues present for you, make sure you contact Avant. I mean, that's one of the reasons why you have a practice indemnity policy, is that you can access some legal advice when you are challenged with some of these issues. So some of the things that I think you could consider is step one, consultation is required with staff about any workplace health and safety matters. If you've not consulted with your staff before making a decision, you really need to consider doing so. Try to bring them around by explaining the rationale for the requirement. Be reasonable and tell them that there is a lawful direction based on workplace health and safety and risk management. Explain what that means, what the risks are, that it's as much about protecting them as everybody else, and explain that the refusal to comply can result in a disciplinary action.
Yeah, that's great advice. But of course, you know, sometimes these difficult staff members, and we're getting certainly calls about this too, where they, you know, have conspiracy theories about the pandemic, and, you know, reading a bit too much QAnon in their social media feeds, and they are sometimes more difficult to manage than the difficult patients. So, you know, managing conspiracy theorists who are refusing to use PPE and quoting stats to other staff while they're trying to get their job done, you know, answering yes to, you know, if they have flu-like symptoms, then challenging their managers to do something about removing them from the practice and making them take leave. You know, how would you manage a staff member like this, Mariana? And it's certainly happening. We're getting the call.
Yeah, and again, under the workplace health and safety laws, we either get their compliance or we manage them out of the business.
So I can make this difficult employee redundant or do a restructure to get rid of them?
Again, I emphasise this as risk advice. You need to be really careful using restructure and redundancy as a quasi performance management tool. If you're even considering that, you need a really clear business reason for restructure. It needs consultation with the practice owners, and you need to be really careful regarding your selection for redundancy. You have to have business reasons to make changes. You can't just automatically choose to do a restructure or to make someone redundant because it's convenient for you to get rid of them in that way. Again, as I said, I'm not a lawyer. I recommend you seek legal advice if this type of thing does present, this type of scenario.
And the Medico Legal Advisory Service is a 1-800 number that the practice can ring if they've got a practice policy with Avant, and you get a lawyer on the other end of the phone, and we encourage you to use that mostly within business hours, because it's although it's a 24-hour service, you know, these people have lives outside of Avant, believe it or not. So can I stand down this employee or change their hours of work, Mariana?
It depends on whether the employee is on JobKeeper or not. And again, I think you need to seek legal advice because the whole JobKeeper landscape is changing and there are a lot of layers to that.
So we have the complexity of employees on JobKeeper, and some we've heard are refusing to work additional hours or come to work at all as they're better off on JobKeeper. Do you want to comment on that, Mariana?
Yeah, I mean, this is certainly, the employment lawyers have said that they're getting a lot of questions about this, and we know just from the media that this is the case, that some people are earning more on JobKeeper than they were before, so they don't want to come to work. I think it's you need to discuss reasonable and lawful direction and what leave entitlements can be arranged when the person is on JobKeeper. And you could potentially implement disciplinary action if this isn't going well or it goes pear-shaped. But again, I strongly recommend you seek legal advice from Avant to help you sort out those sorts of issues.
Yeah, so what about the employee with mental health issues? Because obviously, you know, it's a really stressful time, this pandemic, and people are being affected in all different sorts of ways from, you know, lockdowns and just the fear and everything. So how do I manage, you know, staff with mental health issues, etc.? You know, the stress just
well, I think this is an issue, isn't it, really? Because you know, many of our employees may suffer from anxiety and depression, and you may not be even aware of it. And even if it's anxiety, you know, the COVID-19 has exacerbated people's anxiety. People that don't even suffer anxiety normally are anxious. Imagine the person who is an anxious person, that's going to be exacerbated. And they may have other mental health problems that you're not aware of, but you're suspicious of it, or you may actually be aware of it. And you need to be really careful with dealing with an employee with mental health issues. You need to be very mindful of the workplace health and safety issues around this, discrimination and other related issues. And I know I've worked closely with one of our very experienced employment lawyers who's an absolute gem, and she was helping a practice for a long time. I'm talking about months and months to manage this employee who had mental health issues. So it was very, very, very carefully managed. And as I said, it was not a short-term solution, it actually took months, and eventually it was managed, but it certainly needed very supportive legal advice and pathway set out to actually help manage that employee that had mental health issues. So, Annabelle, what have we been giving advice on if a staff member insists on wearing her own PPE or demands an N95 mask when it's not required by the current guidelines in private medical practice?
Well, again, you could seek legal advice about whether the employer can issue lawful and reasonable direction. Example of that, you know, if the PPE is likely to make patients fearful. If the staff member demands an N95 mask, have a discussion about what the occupational health and safety legislation requirements are, and this does not currently apply to the private medical practice setting. One idea to manage this difficult staff member is to involve that team member in coming up with resolutions to government guidelines. So, for example, a vulnerable worker in a practice we were dealing with decided she would research and rewrite the policy and procedure manual while she couldn't work at the front desk.
And look, this overhead that I've got there now, that link, some of you may be familiar with, but I'd really recommend that you do look at that. There's some great information about dealing with employees, and particularly through the COVID-19 situation. So we're just going to go over some things you could say, in your toolkit, if you like, some strategies in your toolbox to deal with some difficult patients. And this is not just through COVID-19. This is generally dealing with difficult patients. And besides the points that I've put up there, I'll give you some additional points that might just practically assist when you are dealing with difficult person. So if the patient is becoming aggressive, firstly, clarify what's acceptable behaviour. Use the I statements, emphasising the impact on me, the doctor or the staff member, and label the behaviour, not the person, in order to reduce the emotional intensity of the situation. As stated previously, slow down the speech rate, and lower the volume, because patients will very often mirror those behaviours. The receptionist, who may not be managing difficult scenarios very well or are new to the role, provides a really good opportunity for when there is a difficult phone call to actually ask the person to be put on hold, and then somebody who's experienced, either a senior receptionist or the practice manager, takes that call and lets that receptionist, who's either new or doesn't feel comfortable, to sit and listen to how that call is managed. And I'd recommend that's done quite a few times, because once that person is given the opportunity to observe and listen, they will feel more equipped to be able to manage it. And an angry patient can have a really valid concern. So I think we need to question ourselves, is it the patient who's being extremely difficult here without any reason? Perhaps consider viewing this person as being in a difficult situation. Again, rather than putting a label on them as a difficult patient, as that can alter your perception immediately, and it can alter how you're going to deal with that person in front of you. And also ask yourself, is it you? Perhaps consider viewing this person as being in a difficult situation, rather than putting the label as difficult patient. Again, as I said, that can really alter your perception and alter how you're able to deal with that, what's happening in front of you. And always consider for your own personal situation, you know, about, is it you that's not dealing with this very well, or is it you that's contributing? Think about what we call the HALT, contributory factors. So are you reacting inappropriately as you've got no reserves today? Are you hungry? Are you angry? Were you late to work? Are you tired? The HALT contributing factors can really make you less equipped and have less reserves to be able to be dealing with what's in front of you. And let's face it, I think the COVID-19 has worn everybody down, let alone the normal struggles that you have, that you do face from day to day in your practices. And also know your own limits. Being under stress ourselves may mean we're more likely to react with anger, and we potentially can escalate that situation. Use strategies such as learning to take a few breaths. Observe your own reactions, as that can help you to choose how you want to respond. It's also helpful to be aware of your own body language and your tone of voice. As I said, try to keep calm. Use a neutral tone and adopt an open body posture. Be aware if you're not being able to respond effectively. Someone else might be a better placed to deal with this situation. That could be more experienced. They may know this patient better. They may have had a long-term relationship with this patient in the practice. Or they might just be generally having a better day. Or they might be somebody who isn't at the front desk dealing with the stresses that you do deal with at the front desk. And believe me, I've been out of the front desks in general practice, and it is an incredibly stressful environment to work in at times. And have a practice plan for such situations so that you can get somebody else to step in if it's necessary. One of the things that I do find, and I think we all tend to do it, and I've seen it, I'm particularly aware of it when I'm watching a television program where you see, a particularly difficult situation and you hear someone use that word, please, can you stay calm? I find that inflammatory every time I hear that statement, and I know we all feel like saying it, but saying to somebody, could you please remain calm, I think is an incredibly inflammatory statement. It can be phrased quite differently, such as, if we're able to just talk about this in a way that we can both understand, that might help. And also ask, is it the system? What was the patient's expectations about what was going to happen? Was it clearly outlined verbally and backed up in writing if possible? And as we've talked about today, the COVID-19 situation is a good example. The signage, the information on your website, the posters that are put around, as Annabelle referred to, the appointment app, having a pop-up on there about what's to occur. And be very, very mindful that the staff in the practice are safe. Many of you would probably be very familiar about how you should protect yourself, and particularly if we're just talking about the very busy doctor's practice setting, no matter whether you're in general practice or non-GP practice, it's positioning your desks in the consultation room so that that doctor is not pinned in effect behind that desk, so that if it is an aggressive patient in front of them, the desk is positioned in an appropriate way so it's near the door, so that doctor can escape and not be pinned into that sort of restrictive space where they can't get to the door. And the same thing applies to the receptionists. It's got a lot better, but I know years ago the receptionist desks were designed in such a way that there was no way a receptionist could get out of a difficult situation. So where possible, have like two entrances, one on either side of the receptionist desk where there is an opportunity for someone to get out the other side. Or as some practices do, they'll have like the tea room out the back or some other exit that the receptionist can actually exit out the back rather than being pinned by this patient. And also make sure, which many of you probably already have in place, you have a silent duress alarm that's underneath each of the desks at the front desk in the consultation room, but know what the protocols are if that silent alarm goes off. Is it that when that silent alarm goes off, that all the computer screens have something, really quite prominent comes up, and everybody needs to know what the next step is. So is it that somebody is delegated the task to ring the police? Does somebody automatically go into that doctor's room, or a couple of people? Do you get another male doctor to come in and help immediately? But I think the important thing too is to make sure that you practice these responses. We have mandatory fire drills and evacuation drills, and I really do believe that probably every 6 months this sort of drill should also be practiced. What happens if we have an aggressive situation or a violent situation happening in the practice? And build a partnership with your patients, and particularly that difficult person in front of you. Acknowledge you're having difficulties to that person so that you're trying to help. You can use language such as, I'm having trouble working out how we can practically and realistically assist you. Use active listening techniques. Don't interrupt them. Paraphrase what they're saying. Check that you've correctly summed up the situation, and use statements such as I understand it, the problem is that right? Set your boundaries. Tell them what your expectations and your limits are. Use a statement such as, I want to help you with blah, 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 but to do that, I'm going to need your help. Would you be prepared to give it a try? Have open boundaries. Listen to what is important to that other person. Acknowledge it and incorporate it into your agenda. Use their words whenever possible when summarising. Raise the topics that you believe are critical. Don't conspire by silence, and don't try to win, because it never works. Open opportunity for clarification. Use a statement such as, it is my understanding, blah, blah, blah. Try listening. It's a human response to want to defend ourselves against any aggression or unreasonable behaviour that we're faced with. A better strategy is just to try and listen, not take it personally. Don't try and formulate the response in your mind as that person's talking, because that means that you're not going to be really taking in what they're saying. It's a natural reaction, but try not to do it, and try not to interrupt the patient. At best, the patient will have their say, and that may be enough for that patient. They might just want to have their say to diffuse a situation. And as you're quite aware, if it's that person who's starting to get a little bit revved up and it's in front of a lot of people, where possible, take them into a quiet room, but leave the door open so some other staff member can hear what's going on and are ready to come in and assist if it's required. Because as we're all aware, sometimes removing that person from the public arena as such will help them to calm down, because they won't feel that they've got to save face and keep the momentum up. And I think avoid being manipulated. If you feel a patient's being manipulated, manipulating you, you need to be careful not to compromise patient care by giving into unreasonable demands. An example of that is that a patient may threaten to make a complaint to take legal action if a doctor doesn't prescribe a particular drug or sign a certificate or give them a particular treatment. Such patients may be entrenched in their beliefs, and you're unlikely to be able to argue or persuade them. And this is where having clear boundaries or practice guidelines can be particularly helpful, as it's important to remain firm and consistent. Again, try to understand the patient's expectation and try to separate those from their behaviour. If you keep thinking about it is not the person, it is the behaviour, that really will help you when you have that confronting situation in front of you. So Annabelle, I mean, you've had a lot of experience in previous roles of dealing with difficult people. Have you got anything to add?
Only that I've always found it really important to use your networks and speak to other people in similar situations and get ideas for what's worked for them. But develop scenarios and practice, you know, and build a toolkit to assist you when you're in difficult situations. I know my kids often do drills about what to do for all sort of scenarios, particularly during this time. So role playing, I know everyone hates it and it feels really unnatural and ridiculous, but it absolutely helps. So use your networks and role play different scenarios in your practice.
No, that's great advice and practical. And I've listed some toolbox items there that might help. And are there any questions? And I know it's already 8 o'clock. If we don't have a lot of time for questions, you can certainly send them through to Tony Friend, our business development manager. So I'll hand it over to Tony, Amber, to finish off.
Thank you.
I think there is a question.
There is,
in the
yes,
chat.
Tony. Can you see that question?
Yeah.
Okay.
So, Mariana or Annabelle, the question is, we are finding that patients aren't reading any of the signage anymore. The more signs we place around the practice, the less they read. We now even have life-size cutouts of 2 doctors who hold topical signs that we can change. Still, everyone walks straight past. What do you suggest?
That's such a hard one, isn't it? And again, I think it's the different layers of where this these messages are coming from. So, you know, we always talk about adult learning. You know, some people are verbal learners, some people are visual learners. I think we need to use a range of techniques to try and get the message. you know, a lot of patients have TVs in the waiting room, and a lot of practices, and a lot of patients will watch those TVs. Is it possible to have some messages that coming across that TV? And again, as I said, you know, what's on the website, what's on the pop-ups when they make an appointment, what's on the answering machine, and maybe, as much of a pain as it is, to reinforce the message when the patient does come into the practice. And you know, I guess some practices may want to go to the lengths of even giving some handouts when the patient comes in, but that's another layer of commitment, isn't it? And yeah, look, I'd be interested if Annabelle's got anything to offer that, or in fact, if anybody else. No.
Yeah, that's a tough
It
one.
is,
I mean,
it
you've
is.
made some really good points there, Mariana. I think people are getting, you know, pandemic fatigue, and it's problematic.
Yeah.
And it's almost like you need you actually need a bit of an outbreak to get people interested again. And you know, but it's there, and it's possibly wandering around in the community, and we don't know it. Yeah, that's very tricky. But you know, certainly that idea of maybe having it on the TV, the pop-ups on your app, you know, and I guess, I mean, it's difficult, isn't it? Certainly having somebody almost like a concierge at the front door has worked at practices that I've been to out and about.
Yeah, it makes it very hard. Now, okay, I've got to try and hand this over to Amber. Can you hear me?
Yes, I can, Mariana.
Can you tell me, so I'm going to share the screen with Tony now?
I can share the screen with Tony if you like.
Yep.
Just while I'm doing that, Mariana, there's just another question that's come through. Hold on, sorry, just about to share the screen. Do you know of a COVID template for visitors to sign in at the surgery that are bringing patients in? Yes, so have you got a COVID template at all?
I don't think we have, but it'd be pretty. I can source that for you and give it to Tony. It'd be pretty straightforward. I mean, I don't know whether any of you have been to restaurants, etc., and cafes where they're asking for those details, because really all you need to be putting it on there is your name, your mobile number, your street address, and the time that you've entered the practice. That's what most of these facilities are asking, and how long some of them are putting how long you expect, but I don't think that's necessary. But it is about, yes, your name, your address, your mobile number. They do ask the question too, whether you have any symptoms or been exposed to anybody. Annabelle, have you got anything to offer to that?
No, I don't. And I'm sure that it exists. We've just never been asked for it. It would probably be in Safe Work Australia, actually, they've got so much.
I would think that it probably is in Safe Work Australia. So perhaps even have a look there.
Yeah, thank you. We can have a look too at PHN and source something as well, which we can send out with the information from this presentation, I'm sure.
Okay, very good. Well, good morning, and I guess thanks, Mariana and Annabelle. Another great session, very informative. I'm sure the attendees on this call would have got a lot out of it, and you can see my details on the screen now. And as Mariana mentioned, if you do have any further questions or questions that come up later in the day or later in the week, feel free to reach out, and I can obviously get that information answered to you through Mariana and Annabelle. And thanks, Amber, to you for setting this meeting up today. As on screen, my name is Tony Friend. I am the Business Development Manager with Avant for the Wide Bay and the Sunshine Coast. And I just wanted to just take just a few minutes to outline some of the key features of being with Avant and having a practice medical indemnity policy. Because if there is an incident or a complaint in the practice by either the doctor or the staff, chances are that they will sue, the compensation lawyers will sue the doctor or will sue the practice or the entity. So it is very, very sort of important to look, if you do not have a current practice medical indemnity policy, to protect obviously that business. Why Avant? I mean, Avant is Australia's most trusted medical defence organisation, and some of the questions, why practice medical indemnity? I mean, it covers you for patient injury and loss, complaints, inquiries, investigations, employment issues, responding to audits. It's also your reputation of the practice, and we also provide, as it says on screen, a complimentary cyber insurance, which is becoming increasingly more, you know, we see incidents happening weekly these days of ransomware and malware and things like that. Some of the support offered through Avant Law, which is Australia's largest specialist medico legal firm. I think, as Annabelle mentioned, we do have an emergency 24/7 medical legal advice line in emergency situations. As Mariana and Annabelle have shown you this morning, we have a risk advisory service, and we also have a personal business development manager such as myself. Some of the resources, and I urge you, I think Mariana mentioned, to go to our website, avant.org.au. There are a lot of COVID resources and FAQs, and great practice managers resource centres. Avant has over 2,000 medical practice reputations protected, and it's obviously growing. We have more claims and data and experience, and the most important thing is we also have a zero deductible, so you can pick up the phone and call a lawyer and ask for advice, and you don't have to sort of outlay any money with a practice policy. So here is my contact information if you need to reach out, any further questions. Once again, I do thank you for joining us today. Hope you found it beneficial, and always remember, a practice needs a team of people, so make Avant part of your practice team. So I'll hand it back to Amber, and have a great day.
Thank you, Tony. We do have one more question that's just come in from the chat box, if you don't mind. Have you got time for me to read that out?
Yeah, sure.
Great.
No problem.
So a lot of restaurants are only asking one person from a group to sign in. Wondering if we can use that same concept, so not having to have the practice support or the patient support people sign in, because they are with the patient and we've already got those details.
Yeah, I know. I was actually curious to hear that there was perhaps a suggestion that visitors and carers need to sign in. I guess, you know, you can be confronted with that sort of situation where you've got the elderly person who's cognitively not great, or, you know, a mental health person or somebody else who's not actually great at recall or whatever. That's probably where it can be risky. So I was curious to hear that there was an expectation for visitors and carers to sign in, and as you say, you don't do that in a restaurant, although it's interesting, at some cafes they are asking each attendee to do it. So look, it is a hard one, but you know, if it's just you know, a spreadsheet that you can do up and print off with all those details and just leave it for that carer or the other person, it's probably just an extra layer of protection.
And I think too, I mean, maybe you just put a line there saying, you know, if there's another person with you, just tick a box to say yes and their name, so that if you do have to contact trace, they contact the person in the appointment, and the details of who was with them at least are there. And then, you know, should you be contacted for contact tracing purposes, there's documentation that there was someone with you, who it was, and you've got their details if they need to be contacted.
Thank you. And just to add to that, does there need to be a confidentiality clause on it due to it being in medical? It was from another participant.
I would think it'd be very wise to do so, because as you're aware, a lot of the people in the public arena have been quite thingy about using these apps when they go to cafes and restaurants, and in fact have lied and have put different names and different phone numbers just for the sake of presenting that they've actually signed it because they're worried about the confidentiality issue. So yes, I think it's very wise to include that it is confidential information, because it is awkward, isn't it? If you get a carer or another person and they're putting their mobile phone there, and it's always drummed into us about privacy and confidentiality in the practice. But I guess the issue is it's not the patient that you're documenting, it's the carer or the relative who's not coming there as a patient. But I think it's important to reinforce the obligation to confidentiality and privacy. And this is where a QR app would be good, that you can have in your practice, because nobody else sees that standing around in the practice. It's not visible to anybody else in the practice setting.
Yeah, thank you. I think that's the last of the questions. Has anyone else got any questions? You're welcome to unmute if you have got a quick question. Otherwise, you can always send them through to your practice support officer or myself, and we can get back to you. Let's give you a couple of seconds. No? Okay. That's great. Look, thank you so much, Mariana, Annabelle and Tony.
Thanks, everybody.
Thank you.
Thanks, Angela.
Thank you.
Bye.
Thank you.
Bye.
Bye.